This is what really happens to your brain and kidneys when taking creatine. Most people associate creatine only with gaining strength and muscle mass. What many don't know is that it has a significant influence on fundamental organs of our body, such as the kidneys and even the brain. That's why today you'll see exactly the effects that creatine causes on your brain and kidneys, and whether or not you should, according to your particularities, take this supplement that has been increasingly popularizing. We're not just talking about physical gains, but about a compound that interacts with vital systems of our organism and definitely deserves our attention beyond the sports context. Before we begin, please tell us through the comments your name and the city from where you're watching our content. We need to start by breaking a very common myth that circulates out there, that creatine causes hair loss. This is probably one of the biggest fears of those considering starting supplementation, especially among younger men. But let's look at the facts. There is no solid scientific evidence supporting this claim. A study published in the Journal of the International Society of Sports Nutrition followed 56 young athletes during 21 months of creatine supplementation. Researchers monitored DHT levels, a hormone related to male hair loss, and found no significant increases in these levels, nor observed any acceleration in hair loss among participants. Another study with 98 participants conducted by Purdue University compared groups using creatine and placebo for 12 months and concluded that there was no statistically relevant difference in hair loss patterns. Therefore, if you've been avoiding creatine for fear of going bald, you can relax. Science is on your side in this one. Take the opportunity and send this video to that friend of yours who says creatine will make you bald. Now let's talk about the effects of creatine on the brain. Effect number 1. Support for cognitive function. Many don't know, but after muscles, the brain is the organ that consumes the most creatine in the human body. This happens because our brain is extremely demanding in energy terms, consuming approximately 20% of all the energy we produce, despite representing only 2% of body weight. Creatine works in the brain similarly to muscles. It helps recycle ATP, which is the energy molecule that powers virtually all cellular functions. When your brain is working intensely, whether during a study period, an important meeting, or making complex decisions, the availability of ATP can be a limiting factor for cognitive performance. Creatine enters this process acting as a reservoir of quick energy, allowing brain cells to maintain adequate ATP levels even during periods of high demand. Studies with university students have demonstrated that creatine supplementation for 6 weeks resulted in significant improvement in tasks requiring logical reasoning, working memory, and mental processing speed. Particularly interesting is the fact that these benefits seem to be more pronounced in situations of mental stress, such as sleep deprivation or cognitive overload. For example, a study with volunteers subjected to 24 hours without sleep showed that those who had supplemented with creatine maintained significantly better cognitive performance in sustained attention and memory tests when compared to the placebo group. For those who work in roles requiring high concentration for long periods, this potential of creatine can represent a considerable advantage in daily life. Effect number 2, high neuroprotective potential. Creatine plays a fundamental role in maintaining energy homeostasis of brain cells, which is particularly important when we consider that many neurodegenerative diseases are associated with energy deficits and mitochondrial dysfunction. Research published in the Journal of Neurochemistry has demonstrated that creatine can reduce neuronal cell death in experimental models of diseases such as Alzheimer's, Parkinson's, and amyotrophic lateral sclerosis. One of the mechanisms behind this neuroprotection is creatine's ability to stabilize the mitochondrial membrane, preventing the release of factors that trigger programmed cell death. A clinical study conducted at Columbia University with 132 patients in early stages of Parkinson's showed that daily supplementation with 5 grams of creatine for 18 months reduced the rate of motor symptom progression by 31% compared to the placebo group. Additionally, neuroimaging analyses revealed that the group supplemented with creatine showed less dopaminergic degeneration in the striatum, a brain region critically affected in Parkinson's disease. Another promising line of research investigates creatine's role in preventing traumatic brain injuries. A study with contact sports athletes showed that those who regularly supplemented with creatine presented 24% fewer post-concussion cognitive symptoms and faster recovery after mild cranial trauma. These data suggest that keeping brain creatine stores elevated can create a kind of energy reserve that protects neurons in situations of acute or chronic metabolic stress. Before we continue to the third effect, don't forget to subscribe to the channel. Having constant access to correct and science-based information is what will make you age healthily in the long term. Effect number 3, improvement in mental resilience. Another surprising benefit of creatine for the brain is improved mental resilience, especially regarding conditions such as depression, anxiety, and stress. Recent studies have begun to establish a connection between brain energy metabolism and mood disorders. We now know that patients with depression frequently present alterations in energy metabolism in specific brain regions, such as the prefrontal cortex and hippocampus, essential areas for mood regulation and emotional processing. Creatine, by optimizing energy metabolism in these regions, seems to exert a stabilizing effect on mood. A randomized controlled study published in the journal Translational Psychiatry followed 52 women diagnosed with treatment-resistant depression who were supplemented with 5 grams of creatine daily as an adjuvant to conventional antidepressant medication. After 8 weeks, the group that received creatine showed a 56% reduction in depression scores, compared to only 30% in the placebo group. Moreover, treatment response, defined as a reduction of 50% or more in symptoms, was achieved by 65% of patients in the creatine group, versus only 32% in the control group. Another interesting aspect is the response time. The positive effects of creatine began to appear as early as the 2nd week of treatment, while conventional antidepressants usually take 4 to 6 weeks to show significant results. In terms of mechanism of action, researchers suggest that creatine may increase the production of SAMe, a compound naturally present in the body that is involved in the synthesis of neurotransmitters, such as serotonin, dopamine, and noradrenaline, the same neurotransmitters targeted by most antidepressant medications. Now let's talk about the effects of creatine on the kidneys, starting with people who have normal kidney function. This, along with the supposed hair loss that we've already debunked, is probably one of the points that generates most concern among people considering taking creatine. The myth that creatine overloads the kidneys is as common as it is unfounded for individuals with healthy kidney function. To understand why this myth persists, we need to understand the confusion between creatine and creatinine. Creatinine is a breakdown product of creatine that is filtered by the kidneys and excreted in urine. Blood creatinine levels are routinely used as a marker of kidney function. Elevated levels may indicate that the kidneys are not filtering the blood properly. When you supplement with creatine, it is natural and expected that your creatinine levels will increase slightly, which can cause alarm in routine blood tests. However, this increase does not reflect a deterioration of kidney function, but simply the fact that there is more creatine being metabolized in the body. A long-term study published in the European Journal of Applied Physiology followed 23 athletes who used creatine continuously for 5 years and compared them with a similar control group that never used the supplement. The researchers conducted comprehensive assessments of kidney function, including glomerular filtration rate, creatinine clearance, microalbuminuria, and several other markers of kidney health. At the end of the study, no significant differences were found in any of these parameters between the two groups. Another study with 20 college football players who supplemented with creatine doses ranging from 3 to 5 grams per day for 3 years also found no negative alteration in kidney function markers. In fact, a recent meta-analysis that compiled data from 21 clinical studies concluded that there is no evidence that creatine supplementation at recommended doses causes kidney dysfunction in healthy individuals. Therefore, if you have healthy kidneys, there is no reason to fear creatine. Your body is perfectly equipped to handle it. However, when we talk about creatine and kidney health, it's important to highlight that there are specific cases that deserve monitoring and special attention. If you have a history of kidney disease, are being treated for kidney problems, or have significant risk factors such as poorly controlled diabetes or severe hypertension, the approach should be more cautious. In these cases, creatine supplementation is not necessarily contraindicated, but should be implemented under medical supervision and with regular monitoring. A study published in the American Journal of Kidney Diseases followed patients with stage 3 chronic kidney disease who were supplemented with low doses of creatine, about 2 grams per day, for 3 months. The results showed that there was no worsening in kidney function parameters. However, the study was short-term and with lower doses than typically used for sports gains. An important point to consider is adequate hydration during creatine supplementation, especially for individuals with kidney impairment. Creatine has an osmotic property, attracting water into muscle cells. This is part of the mechanism that leads to increased muscle volume. In people with compromised kidney function, ensuring adequate hydration becomes even more crucial to avoid overloading the kidneys. Experts recommend consuming at least 3 liters of water per day during supplementation. Another group that should have special attention are people who regularly use potentially nephrotoxic medications, such as high-dose non-steroidal anti-inflammatory drugs, certain antibiotics, or immunosuppressants. In these cases, the interaction between these medications and creatine is not completely elucidated, and monitoring kidney function becomes even more important. If you fall into any of these categories, the recommendation is clear. Consult your nephrologist before starting supplementation, have regular kidney function tests, and consider lower initial doses, gradually increasing according to tolerance. Besides the effects on the kidneys and brain, creatine has other important benefits for the body. We can highlight 3 specific ones. The first is support for bone health, an aspect often neglected in discussions about this supplement. Recent research has demonstrated that creatine can play a significant role in maintaining and strengthening bone mass, especially when combined with resistance exercises. A study published in the Journal of Bone and Mineral Research followed 42 postmenopausal women for 1 year. The participants were divided into 3 groups: exercise plus creatine, exercise only, and control group. After 12 months, the group that combined resistance training with creatine supplementation showed a 3.2% increase in hip bone mineral density, compared to 1.7% in the group that only exercised, and a small loss in the control group. More detailed analyses revealed that creatine seems to stimulate the activity of osteoblasts, the cells responsible for bone formation, while simultaneously reducing the activity of osteoclasts, which are cells that degrade bone tissue. These results are particularly relevant considering that bone mass loss is a significant health problem, especially for women after menopause and for older adults in general. The proposed mechanism for this benefit involves creatine's ability to increase IGF-1 production, a hormone that stimulates bone formation. Additionally, by improving muscle strength and performance, creatine allows resistance exercise practitioners to train with heavier loads, which itself already represents a greater stimulus for bone strengthening. It's important to highlight that these benefits were observed with the standard dose of 5 grams of creatine per day, without the need for special protocols or megadoses. As we stated at the beginning, increased muscle strength and physical performance is probably the most well-known and studied benefit of creatine, and for good reasons. Creatine is one of the few supplements on the market that consistently demonstrates significant and reproducible results in rigorous scientific studies. The main mechanism by which creatine increases strength and performance is related to the ATP energy system that we explained while talking about the effects on the brain. This system is responsible for providing quick and explosive energy during high-intensity, short-duration activities such as weightlifting, sprints, or jumps. During intense exercises, your body breaks down ATP to release energy, transforming it into ADP. The phosphocreatine stored in the muscles donates its phosphate group to convert ADP back to ATP, allowing you to maintain intensity for longer. In practice, this means you can do more repetitions with the same load, or use heavier loads for the same number of repetitions. A meta-analysis that compiled data from 63 studies concluded that, on average, creatine supplementation increases maximum strength by about 5 to 15%, depending on the exercise and training protocol. For high-intensity, short-duration exercises, such as a series of 10 maximum repetitions in the bench press or squat, the increase in total work volume measured by wait times repetitions can reach an impressive 14%. And as incredible as it may seem, creatine also presents an interesting potential for reducing blood glucose, a benefit that can be particularly relevant for people with insulin resistance or type 2 diabetes. The mechanism behind this effect is related to how creatine influences glucose transport into muscle cells. Research has demonstrated that creatine can increase the expression and translocation of GLUT4 glucose transporters in muscle cell membranes, facilitating glucose entry into the cell in an insulin-independent manner. A study published in the journal Diabetes Care followed 25 adults with type 2 diabetes who were supplemented with 5 grams of creatine per day for 12 weeks, in combination with an exercise program. The results showed an average reduction of 11% in glycated hemoglobin, a marker of long-term glycemic control, compared to only 4% in the group that performed only exercises without creatine. Another study conducted at the University of Saskatchewan with 40 pre-diabetic individuals found similar results, with creatine supplementation for 8 weeks, significantly reducing fasting glucose levels and glycemic response after meals. The researchers noted that this effect was more pronounced when supplementation was combined with regular exercise. It's important to highlight that these metabolic benefits of creatine occur even without significant changes in body weight, suggesting a direct effect on glucose metabolism. For individuals with a family history of diabetes or who present risk factors for insulin resistance, creatine may represent a valuable complementary strategy, especially when integrated into a healthy lifestyle that includes regular exercise and balanced nutrition. Okay, you've already understood that creatine has thousands of benefits for the brain and body. However, here's an extremely important warning. There are some very common mistakes that most people make when taking this supplement that not only cause all its potential to go straight to the trash, but can also cause damage to your body. For example, you should always take creatine accompanied by a carbohydrate for better absorption. Most people ignore this or don't know this information, which isn't specified on the packaging. Therefore, if you want to discover what the other 9 common mistakes people make when taking this supplement are, we've left a video appearing right now on the screen showing and explaining each of them. Don't miss it. Thank you for watching this far, and may God bless you, my friend.